Hi.
Hi, my name is Kristy, and I'm going to be your student nurse for today. Before starting, let me just show my paper real quick. Okay, this is the blank piece of paper. Like this. Okay. I'm just gonna put this right here. For hand hygiene, provide privacy, and then I'm gonna put on my gloves. Okay, how are you doing today?
Good, thank you.
Okay, let's go in here. Let me just put these on. Alright, I'm just gonna start off by having your full name and date of birth.
Okay. Married for September 8, 1990.
Okay, and that makes you how old?
29.
Okay, and what is your marital status?
I am married.
Okay, and a good phone number for you?
Area code 435-216-8310.
Okay, and your marital status?
I'm married.
Okay. Alright, what brings you into the clinic today?
My head hurts.
You have a headache? Okay. Could you tell me a little bit about this headache from the time it started to the time you came?
It started last week and I still have a headache.
Okay. Alright, and what makes it better and what makes it worse?
When I lay down.
Okay, and quality measure, how is the pain? How would you say
It's sharp.
Sharp, okay. And do you take any relief measures for this?
No.
Okay, and does it radiate anywhere?
No.
Okay. Alrighty, and could you tell me where it is? Like, can you point to it? Right there? Okay. And timing, is it constant or does it come and go?
Come and goes.
Comes and goes. And what aren't you able to do because of this pain?
Nothing. I could do everything. Just hurts sometimes.
Just hurts, okay. Alright, and do you have any other pain besides this pain?
No.
Okay. And do you have any allergies? This includes medicational, seasonal, latex.
No.
Can I see your wrist back, please? Okay, thank you. Okay, so I'm just gonna ask you a few more questions. Is that okay? Okay, it's just about yourself. Let me get this. Have you had any childhood illnesses? This includes the measles, the mumps, or the chickenpox.
No.
Okay. What about any major accidents? This includes car accidents, head trauma, or major burns.
No.
Okay. And what about any let me see, major burns. What about any chronic illnesses? This includes diabetes, hypertension, asthma?
No.
No? Okay. Alrighty, and so now I'm just gonna ask her about her family history. Okay. Alrighty, has anyone in your family been diagnosed with any severe disease like asthma, diabetes, or hypertension?
No.
Okay. And what about your parents? Are both of your parents still alive?
Mhm.
Okay. And how would you say their health is for their age?
They're pretty good health.
They're pretty good? Okay. Alrighty. Let's see. Okay, and on your headache, from 0 to 10, 0 being no pain or 10 being the most pain, how would you rate your pain?
Out of 5.
Out of 5? Okay. Alright, thank you. Okay, just a little bit more questions about yourself. What is the last grade you completed?
Some college.
Some college. And do you take any self-care relief measures for stress or anything?
No.
You don't?
Oh, I go for walks. I'm sorry.
Oh, you go for walks? Okay, that's good. Do you have any religious practices many people have?
No.
Okay. And is your financial status adequate for your lifestyle?
Yes.
Okay, thank you. And how well do you sleep at night?
I sleep pretty good.
Pretty good. Okay. And do you take any naps during the day?
Mm-hmm.
Okay. And how would you say a typical day from you is, from like to the time you wake up to the time you go to sleep?
I wake up, take a shower, eat, and then I go to school, come back. Then I have lunch, and then I study and eat again, and make dinner and clean the house and go to sleep.
Okay, and that's your usual days?
Yes.
Okay. Alrighty, thank you for that. Okay, these other questions are going to be a little bit more personal, but just be as open and honest with me, okay? There's no judgment here, it's just to give you resources, okay? Do you drink alcohol or
Yes.
do drugs? Yes to...
I drink alcohol.
Oh, you drink alcohol? Okay. And in a typical week, how many days a week do you drink?
I drink 1 day a week.
1 day a week. And in that drinking day, how many drinks do you
I
have?
have 1.
One drink, and is it one?
It's like 4 ounces.
1 4 ounce. Okay. Okay. Now I'm gonna do a cage assessment since she did address that she drinks. Do you feel the need to cut down?
No.
Did you feel annoyed when people tell you need to cut down?
No.
Do you feel guilty about drinking?
No.
And you need an eye opener to get your day started.
No.
Okay. Moving on to questions. Again, they're still more personal. Since domestic violence is so common in our society, we're asking all individuals these questions. Do you feel safe at home?
Yes.
Okay. And are you afraid of your partner?
No.
Okay. If she would have said yes, I would go ahead and perform a danger assessment. Okay. And over the last 2 weeks, have you felt down, hopeless, or depressed?
No.
Okay. What about over the last 2 weeks? Have you felt little pleasure in doing things you usually do?
No.
Okay, if she would have said yes, I'll go ahead and perform the PHQ-9 and ask her the following 2 questions that include, do you feel like life is not worth living, and do you have a plan to hurt yourself? Okay. Alright, so now going on to the mental assessment. I can see that my patient's appearance, her posture is erect, her body movement is appropriate, her dress is appropriate for the season, and her hygiene and groom is well kept up. Her behavior, my patient is alert, her speech isn't too rapid, too slurred, it's clear. And the cognitive, do you know where we're at right now?
Yes.
And do you know the year?
Yes, it's 2020.
And where are we at right
We're
now?
at the hospital.
Okay. Okay, so my patient, she's oriented to place and time, and she's oriented to person because she can tell me about herself and what's happening to her. She also has good attention span. She doesn't get easily distracted, and she has recent and remote memory because she could tell me past events and recent events. And thought process, she does make sense, and she's not suicidal, as we saw in the other assessment. Alrighty, so thank you for that. Okay, we're gonna go ahead and do your vitals and nutrition. Okay. Do you have any questions for me at this point? Okay. So I'm gonna go ahead by saying the normal ranges. Respirations normal is 12 to 20, pulse is 60 to 100. Blood pressure is lower than 120 over 80. Pulse, the oxygenation, pulse oxygenation is 95% to 100%, and temperature is 96.8 to 100.4. Yeah, 96.8 to 100.4. Okay, so I'm just gonna start. Okay, I'm gonna start by getting the temperature. Okay, I would clean this off with an alcohol swab, and I'll just make sure her forehead is clean and dry. Okay. And have you smoked, did any exercises in the past 30 minutes?
No.
Okay. Drink any caffeine or anything like that?
No.
Alrighty, thank you. Okay, so I'm just gonna start reading your forehead. Okay, so I got 98.7, which is in the normal range of 96.8 to 100.4. Okay, so I'm gonna go ahead and do the pulse ox. Just gonna clean this off with an alcohol swab, and then I'm gonna clean off her finger. I'm also gonna be checking to see if she has any nail polish that would interfere with the reading. Okay, is this finger fine? Okay, just relax your hand. Okay, and then I'm gonna go ahead and I'm gonna be doing respirations at this point. Okay, so I got 8, so 8 by 2 is 16. So that's good. It's in the normal ranges of 2 to 20. 12 to 20. And then now I'm just gonna be looking at her oxygenation. Okay, so she has 97 for oxygen and 82 is her pulse. So again, it's between the normal ranges of 60 to 100. Okay, thank you. Okay, so now I'm gonna go ahead and do blood pressure. Okay, I'm just gonna ask her some questions. Do you have any PICC lines, any fistulas, any breast surgeries?
No.
Okay, is this arm okay to use? Okay. So I'm just gonna go ahead and do blood pressure. I'm gonna be doing the two-step method. Okay, is that snug?
Mm-hmm.
I'm just gonna find it. Okay. And I'm just going to pump it up until I do not feel the radial pulse. Okay. Just relax your arm. Okay, I stopped feeling it at 100, so I would go up 30 points from there. Okay, and I would wait a whole minute as well. But in this case, I would just ask, is your arm okay to do it again? Okay. Okay, so I'm gonna go ahead. Alright, so I got 100 over 70. Is that your usual blood pressure?
Mm-hmm.
Okay. And if there was like a 20 point difference, I would go ahead and report to the physician. Okay, and then that'll get us in the normal ranges. Okay, I'm just gonna slide this under here. Okay. So you got all your vitals. Okay, now I'm just gonna go ahead and we're gonna go to nutrition. Okay. We're gonna have you go and weigh yourself and do this snatch and all that. Okay. So if you could follow me, we're gonna start with. Is it recording?
Yes.
We're gonna start with doing the stand chart. Okay, I'm gonna stand 20 feet. Okay, in this case, we're just gonna do 10 feet because that's the only room we have. Can I have you stand right here, please? And then I'm gonna have you start off with both eyes and read the smallest line you could read.
EDFCZP.
Okay, and then can you cover your right eye? Okay, and what's the smallest line you could read?
EDFCP.
Okay, and then can you cover your left one?
It's EDFECZP.
Okay, thank you. So the patient has 20/20 vision in both eyes. I would be noting if she has any squinting leaning forward. If it was below 20/30, I would refer her to an ophthalmologist. All right, thank you. And while we're here, we could also go ahead and get your weight. So you can come here and step on the scale for me. Okay, so my patient, she weighs 160. Okay, and I'm gonna have you get your height. Okay, we can see that she is 5'4". Okay. Okay, and while standing right there, I'm also gonna do your waist circumference. Okay, I'm just gonna go in right here, okay? Go in between you. Okay, we have 35 inches. Okay, can you go ahead and sit down for me? Okay, and I'm gonna go ahead and calculate the BMI while I'm right here. Okay. Okay, Okay, so then I have 5'4", and then I'm gonna convert it to inches, so it's gonna be 64. I'm gonna convert the pounds to kilograms, which is gonna be 72.7 kilograms, and the BMI would be so then I have 27.5 as my BMI, and then here's just my work right here. I don't know if y'all can understand that. Here's the BMI, here's my height to inches, and then here's my pounds to kilograms, I believe, right there. Okay. Alrighty. Alright, so I'm gonna go ahead and I'm gonna be doing the physical part of the assessment, okay? Do you have any questions for me right now?
No.
Okay, so then I'm gonna start on the head. I'm going to go ahead and check the hair distribution on the head. Okay, so I can see it's evenly distributed throughout the whole head. I'm also gonna be looking at the score to see if it is normal cephalic, which is round, symmetrical, and appropriate for the body size. Now I'm gonna go ahead and palpate the skull, and I'm gonna be checking for any protrusions, lumps, abnormal depressions. Okay, I can see my patient doesn't have any. Okay, and now I'm just going to go ahead and go on to the eyebrows. The eyebrows are symmetrical. There's symmetrical distance between the two. Now I'm gonna go to the eyes. Can I have you close your eyes for me? Okay, so my patient can close the eyes completely, and she also has full distribution of the eyebrows. While closing the eyes, I could also note that she doesn't have any swelling, redness above the eyelashes. Okay, so now I'm just going to be looking at the eyeballs. I can see that there's no protruding of the eyes. That would be exothalamus, and there's not sunken in the eyes. That would be endothalamus. And now I'm just going to pull down the conjunctiva. Okay, I can see that the conjunctiva is pink and glossy. There's not any redness. The sclera is also white and glossy. Now I'm just gonna go on to the ears. I can see that they're equal bilateral. I'm going to go ahead and check the ear. I'm gonna be checking the ear for the skin intact, for checking for any lesions, any wounds. I'm also gonna be checking for the opening of the ear, cerumen. Okay, there's not any of that. If there was cerumen, I will note the texture, the amount. I'm gonna be just checking the ear. Alrighty, and I'm gonna go ahead and I'm gonna go check the other ear. Okay. I'm going to be checking the outer ear. Also, I'm going to be checking that the skin is intact. I'm going to be checking for lesions, wounds. In the inner ear, I'm going to be checking for the opening to see if it was symmetrical to the other one. And if there was a room, I will note the texture and the amount. Okay, so now I'm just going to go ahead and I'm going to check for tenderness. I'm going to pull up and back. Okay, I'm just going to be checking the ear. Do you feel any tenderness here?
No.
What about here?
No.
Okay, and then that's good. So now I'm gonna go ahead and I'm going to perform perla. Okay, so perla, what perla means is that the pupils are equal round. Pupils equal round, reacted to light, and they accommodate. I'm just gonna start with pointing the light into the eye. This is going to be direct, and the pupil that dilates is going to be the consensual constriction. Okay, so now I'm just going to point the eye. Before doing that, I'm just going to measure the pupils that are 4 right now. Okay. Alrighty, so then when I point the light to each pupil, they constrict it down to a 2. Okay. And so now I'm going to go ahead and do accommodation. Can I have you look at the pin without moving your head? Okay, so pupils are equal round, reacted to light. Okay. Okay, so now I'm gonna go on to the nose. Can I have you smile for me? Okay, so I can see the nasolabial folds are equal on the sides of the mouth. They're symmetrical, there's no drooping. Now I'm just gonna go on to the oral cavity. Can I have you smile for me? Okay, I'm just gonna be looking at the lips to see if they're pink and moist. Can I have you open your mouth for me, please? Okay. What do I do with my pen? Okay, I'm just gonna be looking in, and I'm just gonna be checking the tongue to see if it's pink and moist. I'm looking for any lesions in the buccal mucosa. Okay, everything looks good for me. Now I'm just gonna go ahead and do sensory. Okay, and I'm just gonna have you close your eyes for me. All right. Okay. So I'm just gonna, whenever you feel something, just say now.
Now, 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 now.
Okay, with your eyes closed, I'm gonna go ahead and do smell. Okay, they're gonna be two different smells. I'm just gonna include one nostril and just tell me what you smell.
Mint.
Okay.
Orange.
Okay, that's good. Okay, so now I'm just gonna do motor. Can I have you puff out your cheeks for me? Okay, they aired that out symmetrically, so that's good. Now I'm just gonna go on to gag, cough, and swallow. Can I have you cough for me? Can I have you swallow? Okay, and then I would gag. Okay, thank you. That is good. Okay, so now I'm just gonna go on to the go on to the neck. I can see that the neck is midline and erect. Can I have you do some range of motions exercise for me?
Mm-hmm.
Can I have you go like this? Head back, head to the side, and then ear to ear. Okay, did you feel any pain while doing any of this? Okay. Okay, now I'm just gonna be checking for the distension of the jugular vein. Okay. Can I have you turn to the other side? Okay, I see that there's no distension. Now I'm just going to palpate and auscultate the carotid artery now. And I'm also gonna grade it while I'm here. Okay, can I have you turn? Okay, the other side. Okay, I can see that the carotid artery, I give it a 2+ for normal, 0 is absent, 1 is weak, 2 is normal, and 3 is full or bounding. Okay, I'm gonna go ahead and auscultate the carotid artery. Can I have you breathe out and in, and hold as I go to each side? Okay. Okay, you check. Okay. So have you relax and do the same. Have you check. Okay, so I was hearing for any sounds such as bruise. I heard nothing, which is a good sign. Okay, so now I'm just gonna go ahead and palpate the rest of the distal pulses. Okay, I'm gonna go ahead and do the brachial artery. The brachial 2+, brachial 2+, radial 2+, ulnar 2+, radial 2+, ulnar 2+, and then we usually do the femoral as well, but we're not gonna do that in this case, and then we're gonna go ahead and do the popliteal. Okay. So it's 2+, it's really hard to find. And now we're gonna be doing the dorsalopetus. Okay. It's on top of the foot, 2+, posterior 2+, and then again, dorsalopetus, and posterior 2+. Okay, you could just relax, and now I'm just gonna go ahead and listen to your heart sounds, okay? I'm just gonna go on this side. Okay, and before doing that, we have the aortic, the pulmonic, the Erb's point, and then we have the tricuspid, and then we have the mitral right here. Okay. Heart sounds good, normal pace. Okay, so now I'm just going to listen to the breath sounds from the anterior. Can I just have you take a breath in and out? Usually we would do 3 cycles, but now we're just going to just do one. Okay, can I have you take a breath in and out?
Oh, yeah, sorry.
Good. So anterior lung sounds were clear. There's not any signs of wheezing, crackling. Okay, so that's good. Now I'm gonna go ahead and do the posterior side. Okay, so I'm gonna do the same. Okay, so lung sounds are clear on this side as well. No sounds of cracking. Now while I'm back, I'm just gonna do tactile thermitis and just check for vibrations. Okay, so every time I put my hand right here, can you say 99?
Yes. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so she has normal vibrations. Now while I'm back, I'm also gonna be doing chest symmetry. I'm just gonna pinch a little bit of skin and then have her breathe in and out. Okay. Then breathe in. Okay, so as she inhaled and exhaled, it went up symmetrically in and out. Okay, while I'm back here, I'm gonna be doing coastal vertebral tenderness. Okay. Did you feel any tenderness here?
No.
Okay, so this is gonna be this is just gonna be checking for any kidney inflammation. Okay, so she doesn't have any. Now I'm just gonna turn you right here. Okay, so now I'm just gonna be checking her AP diameter. If it's 1 to 2, 1 to 2 is normal. If she has 1 to 1, that would indicate viral chest or chronic emphysema. While I'm here, I'm also going to be checking for her sternum to see if she has either pectus excavatum, which is sunken in of the sternum, or pectus carnatum, which is protruding of the sternum. So she doesn't have any of that as well. Seeing her breathing and her pattern, she at the rate of, I believe, she at the rate of 16, so it's good. And then she also had a good pattern. There wasn't labored. It was constant. Okay, so now I'm gonna go ahead and go to range of motion. Okay, so I'm gonna start off with the temporomandibular joints. Okay, can I have you open and close? Okay, I'm just checking for any crepitus or pain. Did you feel any pain? Okay, I'm gonna go against the shoulders. Can I have you go up and down? Okay, I'm gonna be checking for crepitus. I didn't feel any crepitus there. Do you feel any pain?
Yeah.
Okay, can you go against my force? Okay, thank you. And then can I have you do some range of motions? Can I have you go up like this and down like that?
Okay.
Okay, go ahead. Alrighty, thank you. And now I'm just gonna go ahead and do your elbows. Can I have you go in and out for me like this? Okay, I didn't feel any pain. I didn't feel any crepitus. Did you feel any pain?
No.
Can I have you go against my force now? And, okay, thank you. And then can I have you wiggle your wrists in and out? Okay, and if any crepitus, did you feel pain? Okay, can I have you do this? Alrighty, thank you. Now I'm going to be going on to the knees. Okay, can I have you in and out? Okay, I didn't feel any crepitus, any pain?
No.
Okay, now I'm going to go on to the ankles. Okay, can I have you turn? Okay, in and out. Can I have you turn in and out your foot as well? Okay, thank you. And now I'm just going to go against my pressure. Okay, again. Alrighty, thank you. Okay, so then can I have you do that one more time? Okay, so I can see she has good lower body strength. Can I have you squeeze my fingers for me? Okay, thank you. So she also has good upper body strength as well. Okay, so now we're gonna go on to mobility and muscles and stuff like that. Okay, so now I'm just gonna palpate you and I'm gonna be checking for your muscle symmetry and tenderness, okay? So I'm just gonna be palpating you. Okay, I'm just gonna be checking for muscle symmetry. Did you feel any tenderness while palpating? Okay, so the muscle symmetry is the muscle symmetry is appropriate, and she didn't feel any tenderness. Now I'm gonna go ahead and do warmth. Okay, I'm just gonna feel the body for any warmth. The back of my hand all the way to the lower extremities. Okay, so my patient, she was warm to the touch. Now I'm also gonna be checking for any edema. Okay, I'm gonna be checking on the wrists and the ankles. Okay, can I see the ankles? Okay, she's there's no signs of edema, but if there was, I would grade it 1 mild, 2 moderate, 3 mild. 1 plus mild, 2 plus moderate, 3 plus deep, and 4 plus very deep. Okay, and now I'm just going to be checking the body for any lesions and wounds as well. Okay, I don't see any present. Do you have any wounds or lesions present?
No.
Okay, if she would have wounds, I would check the location, the size of the extra, which would have been the color, the odor. I would be checking lesions for asymmetry, border, color, diameter, and elevation. Now I'm just gonna be checking the skin color. The skin color it's appropriate for her genetic background. She doesn't have any pallor, any cyanosis, any jaundice present. Now I'm gonna be checking her capillary refill and her net bloods. Okay. Okay, capillary refill is less than 2, and I don't see any signs of clubbing in either of the hands. The nail beds are pink, round, and smooth. Okay, so that's good. Okay, so now we got the body tenderness. Okay, the patient's also not too dry or moist. It's balanced temperature. Okay, so now I'm just gonna go ahead and have you stand up for me, please. Okay, I'm gonna go ahead and do your range of motion on your hips. Can I have you kick out sideways? And the other side? Can I have you bend down for me? Okay. Did you feel any pain there?
No.
Okay, so I didn't feel any crepitus on her hips or her spine. Okay, you can sit down for me. Okay. Okay, let's go see. Okay. Alrighty, so I'm just gonna go ahead and have you lay down for me. Okay. Alright, so I'm gonna just be I'm gonna start by checking over the abdomen. I'm gonna be checking for pulsations over the major arteries over the chest and the stomach. I'm gonna be checking for any striae, venous patterns, the contour, if it's flat, scaphoid, protuberant, or rounded. In this case, it's flat. I'm also going to be checking in the 4 quadrants. I'm going to be hearing in each of them. Okay. So then, before starting, I'm gonna auscultate the major arteries. We have the aortic, the left and right, the right and left renal arteries, the right and left ilium, and of course the right and left femoral. Okay, so I'm just gonna auscultate first. Okay, we have the aorta, the right renal, okay, and then of course the femoral. Okay, so now I'm just going to hear over the 4 quadrants as well. Okay, so all 4 quadrants we had normal active bowel movements. Okay, there was not any hyperactive absent or barbarous sounds. Okay, so now while we're here, we're gonna be palpating for any distension, any tenderness. Okay, do you feel any pain here?
No.
What about here?
No.
Here?
No.
Here?
No.
Okay, so there's no, she didn't feel any tenderness. There's also no pain or distension. Okay, so now I'm just gonna percuss. While percussing, I'm gonna be hearing for either tympani, which is the air that has risen above the abdomen, or I'm gonna be hearing for any dualness, which is it can be liquid, mass, or a distended organ. Okay, so I heard tympani, everything's good. Okay, so now I'm also going to be checking the midline for the bladder. Okay, so now I'm going to be checking all 4 quadrants and naming something that's in each 4 quadrant. It's right lower is going to be the appendix, the right upper is the liver, the left upper is the stomach, and the left lower is the distended colon. And of course the middle would be the bladder. Okay, so now I'm just going to be, while I'm here, I'm going to be doing shifting dualness tests. I'm going to start with the side that I hear tympani all the way to where it will be on the side where the fluid goes, and then I'll mark where I feel the dualness. Okay, so then I'll just go. And then all the way till I feel the dualness, and in this case I don't feel dualness because she doesn't have ascites, because this test, it tests for ascites. And then I'll have her roll over, and then I'll go again and go from the tympani to the dualness and mark it as well. Okay, so now I'm going to be doing the ileocephalosis test. This is going to be me checking for appendicitis. Okay, and I'm going to have her raise her right leg, and she's going to go against my force. Okay, thank you. Did you feel any pain right there?
No.
Okay, and then I'm going to have you do some more range of motions over here as well. Can I have you stick out your leg? Up. Okay, and then the other one. Okay, so then active range of motion is me, the patient doing the motions on their own, and passive would be me assisting them with moving the joints. Okay, so now I'm just going to be doing, we have the lower body strength. Okay, we did the lower body strength as well. Okay, so now I'm just going to be asking you a few more questions. Is that fine with you? Okay. Okay, so I'm going to get my paper. Alrighty. Okay, when is the last time you went to have a bowel movement?
This morning.
This morning at what time?
At 8 a.m.
8 a.m. Okay. Okay, and since I don't have the bowel movement here with me, I'm gonna be asking for like the characteristics. I'm gonna be asking like the amount, the odor, any abnormalities. Okay. So did you see any abnormalities in your bowel movement? Was it hard to pass? What was the color?
It was brown.
Okay, and what about the amount?
It was normal, not medium.
And what about any odor?
Normal order.
Okay, normal odor. Okay. Alrighty, so then I'm gonna go ahead and ask a few more questions about daily living. Okay, are you able to feed yourself without any help?
Yes.
Okay, are you able to dress yourself, like put on clothes without any help? Okay, what about transferring? Are you able to come in and out of your house without any problems? Okay. What about toileting? Are you able to go to the restroom and able to perform toilet hygiene?
Mm-hmm.
Okay. Dressing. What about bathing? Are you able to go and take a bath and go in and out without any problems as well?
Mm-hmm.
Okay. Okay, then we have continence. Are you able to go to the restroom without any accidents?
Yes.
Okay, that's good. Okay, so I'm gonna go on and move on to the fast scale. I can see my patient's face isn't drooping. Can I have you go like this for me? Okay, and I can see that one arm doesn't droop down than the other. Okay, S stands for slurred speech. My patient Can we say the weather's beautiful outside?
The weather's beautiful outside.
Okay, so she's able to say this without any problems. Okay, and then we have the glaucoma scale. The T stands for, it would be time to call 911. So if she would have any difficulties with the FAS part, it would be time to call 911 because it would be indicated of a stroke. Now we're gonna go to the glaucoma scale. I guess my patient, she opens her eyes spontaneously, so I'm gonna give her a 4. She was able to obey motor command, so that means that she could relate to stimuli, pain stimuli, so I'm gonna give her a 6. And then my patient does not have slurred speech, so I'm gonna give her a 5 with a total of 15. Anything lower than a 7 would be indicative of a coma, so she got that, she did good on that. Okay, and then I'm gonna just do one more test. It's gonna be the hearing test, okay? Okay, so I'm gonna have you just close your eyes for me. Okay, and then just tell me where you hear it at.
Okay.
Alrighty, thank you. So she was able to pass the whisper test, and I could also know that she could hear because she can converse in conversation as well. Okay, so this is so she did pass the finger rub test. Okay. Alrighty, so we have all the tests down: the FAST, the glaucoma, and the hearing test. Okay, so I believe that's it.